process. And quite simply explained is that it basically helps to stimulate and manage the osteoclast application or stimulation process in order to generate new bone. Trucks go in, trucks go out, osteoclast, osteoblast. So that's a whole process, and it happens over time. And we find that from all the research reports, PEMF speeds up that process and ensures there's adequate eddy current in order for this to work. Organ health, everything needs a rhythm, a signal. Blood circulation has been widely reported over the years, and we're all very well aware of the benefits of that and how it interacts with the blood cells and has the potential to help increase the voltage, which helps them repel each other. Like charges repel. So if you improve the voltage in the cells, the potentials, they will then repel each other single file and can then help oxygenate tissue, can help improve circulation into the tissues. And there's many conditions where it is well known where if you can improve tissue oxidation, if you can improve the circulation into the tissue, you are going to have a better quality of life, and you have the potential to reverse the disease or the diagnosis just by improving those aspects of the symptoms. Muscle repair, we all know about different shoulder impairments, how tissues and tendons all connect together, and pain relief is well known. It's been approved in Canada to treat pain, and that has been for many years. So these are all well documented. It's all safe to say PEMF can benefit in this. Where you really just want to focus is when you put it in a device-specific manner, because then that device will have to have the approvals to go with that topic, that condition, that disease you are speaking about. The great thing about that is you have the ability in order to help different areas, help different population health segments, and really have the professional and the clinical research to back you up in how you are making those different decisions. And there's so much evidence that shows the electromagnetic field is involved in many biological processes, which are of great importance to the body. And discovering the therapeutic intervention is a complete game changer. It's non-invasive, safe, it's an effective therapy without side effects, which is huge. How many therapies do the medical and healthcare establishments administer with side effects? Here, there are mild, if no, side effects reported from decades and decades of applications and use of pulse electromagnetic fields, specifically magnetic resonance stimulation in low level. And what we're all looking for now is to get those answers to what does PEMF prevent is treatment parameters. There are not enough well-designed, high-quality studies that standardize treatment parameters and protocols for all these various applications. And some of the difficulty is because you're using energy, and energy travels throughout the entire body. So it affects everything. So it's hard to get duplicatable outcomes when you are utilizing a variety of individuals. But the most accurate way to describe the benefit of PEMF and what it is doing is it is prolonging the span of health. And if you would want to take a look on PubMed.gov, these are all the topics you can type in with PEMF and come up with tons and tons and tons of research. Eye health. Eyes are the most energetic component on the body, and you can halt, mitigate, prolong, and a way to help repair damaged eyes. And there's a ton of literature in how people use light stimulation and how people use different PEMF and lasers, and you are able to repair and reverse eye health. Bone repair, we've talked about that. Prostate health, one of the reasons that I am an active user. I'm looking to avoid any type of prostate complications. And from reading the research in the clinical studies done, most prostate issues begin with inadequate blood flow to that area. So anytime I'm working on the computer, such as now, giving a lecture, I'm sitting on my Omnipad. And that is how I am mitigating the risk from having any type of inadequate blood flow to that area for a prolonged time that could affect the health of a prostate. So this is how we have to think about integrating PEMF into a healthy aging, increasing the health span, because that is really where our focus should be, is prolonging the span of health, not trying to avoid diseases, because that's, I mean, there's so many out there. How you get, it's better to focus on health and healthy aging than trying to avoid all these different things and all the different media and news things telling you do this and do that. Improved digestion. People have an issue assimilating their food. That could be an energetic issue. Maybe the cells need to be working. Also, the microbe in the digestive tract is highly related to stimulation by magnetic fields. It almost has its own magnetic energy and its own magnetic frequency. Pain relief, we've talked about. Muscle repair, anti-allergen, ear health. There's a bunch of research into PEMF and tinnitus. But again, you can take a look at any of these topics, type in PEMF, and this is the website you would go to get viable information. And you can actually choose any topic and put it in there, and you will see quality research that the government has put in the National Library of Medicine. And so this information is coming from the National Library of Medicine. You can look at many topics, and it is a vast source of information from 1930s all the way until now into the investigation of pulse electromagnetic field. And I repeat again, apparently no side effects have been reported using low-level pulse electromagnetic field within the natural frequency spectrum of the beta, alpha, delta, theta. No apparent side effects. That's huge. And then look at all the potential benefits. When we say healthy aging, what we are saying is that during the aging process, we find from the medical research, when your functioning begins to diminish from either lifestyle or behavioral, or there's different pharmaceutical strategies that can be used. When you're functioning, activities of daily living, in a sense, begin to diminish, that is when all of these areas begin to show themselves in a cascading effect. Functional limitations, disease, disability, all then have the potential to take effect. And over time, the risk and the probabilities become greater. So the primary prevention, the primary target time is during the aging life cycle before you get to loss of function. So that is when you want to start thinking about bone repair, before you get to the osteoporosis, before you get to the brittle bones, is when you want to start thinking about bone repair. When do you want to think about improving your digestion? Before you have any type of gut issues, any type of discomfort. You want to start thinking about these things. So if you are moving along in the aging, and we'll talk about the aging process and PEMF and prevention on the next slide as well. But as if you, like me, are moving along on the aging continuum, you want to start thinking about all of these different areas. Eye health is a huge concern of mine because the 23andMe report said of a risk for age-related macular degeneration. Well, one thing I know about eyes, that all begins because the recycling in the cones and the rods begins to lose functioning. So my primary prevention, my own primary intervention is using light stimulation in the early morning, mid-morning, is using the pulse electromagnetic field pad on my chest so the field generates up into the eye area. And to this point, 47, I have no symptoms whatsoever about this becoming a reality. Why am I doing it here during the primary prevention area? Because I don't want to lose functioning. And if you don't want to lose functioning, like the statement says, if you don't use it, you're going to lose it. So let's start stimulating these different areas where we may know about ourselves and prevent these type of health challenges, conditions, diseases, diagnosis from having a greater risk of setting in. And when you ask what can PEMF benefit, here it is: muscle repair, pain relief, boost immunity, improve digestion, blood circulation, eye health, neuroplasticity. That means that if you have negative thought patterns, discoherent thought patterns, patterns that are dominantly anxiety, worry, stress, you can use cognitive behavioral therapies with PEMF and rewire the brain. Bone repair, that is huge. Why do you want to wait to get brittle bones before you start doing something about it? Because if you do something about it now in your 40s, you can play pickleball till you're 100. Prostate health, again, why would you want any issues down there? So let's take a look at it and mitigate the causing risk factors to people who do have issues down there. Organ issues, kidneys, liver, your liver regenerates. Anything in the body that regenerates needs a high electrical current in the area in order to have proper repair, regeneration of the wound through all the different stages. We know this to be a fact because PEMF is used to treat diabetic sores that won't heal. If the sore will not heal through the entire stages of the healing process, they will prescribe PEMF, and there's a high efficacy that it will heal. Well, if we know this, you can utilize it in a preventative way and regenerate things prior to losing function. And that is what prevention really means that you are doing preventative maintenance on your car before it breaks down on the highway. So you want to do preventative maintenance on yourself before you break down on the pickleball court. So you need to really take a look at what areas do I really need to put some attention into, because I do not want to lose functioning. And this could either be, you may have had issues in the past. This could be from a family history, or just from what you know about maybe some sport or a health challenge you had recovered from, that you know that you need to pay extra attention in order to not lose function as you go through the aging continuum. Basically, what the research tells us is that the average health span is 63 years, and the average lifespan is 79 years. To me, 63 is really not that old. So to think that you're going to lose your health at 63, to me, is why I am doing things that I am doing, is why I'm doing PEMF for prevention, but most accurately stated, using PEMF to prolong the health span. I would like my health span to diminish, if not at all, but I would like to have it go to 79. To me, that sounds more where we should be in 2021, because we were headed in that direction. And to the last recent years, the health and the age that we do die has all diminished. So we are actually going backwards. And I had just, we just did a whole report, and it was just concluded that the US healthcare system is 0, the worst out of the top 10 industrialized economies in the nation, is where we stand. So healthcare, and we spend $600 billion annually. You think we would be the healthiest nation, considering we outspend most of the whole entire world, and that we would be a more preventative measures. But this is where we need to really take a look at prevention and what we are doing with PEMF. We're prolonging the health span. And the process of an aging, you have inflammation, oxidative stress, mitochondrial dysfunction, which Ali has talked about, and you all should be very versed on, stem cell exhaustion, cellular senescence, genomic instability, epigenetic alterations, age-related disorders, Alzheimer's disease, diabetes, cancer, disability, CVD, Parkinson's disease, osteoporosis. We all know someone who has utilized PEMF and has had health benefits with these age-related disorders. So why do we need to get to the disorder? Let's focus on prevention. Let's focus on increasing the health span and not focusing so much on the specific disease itself, in the fact that let's focus on preventing all of this from happening by increasing the health span and taking a look at the processes of aging. And you can go to the National Institute of Health and you can type in PEMF and inflammation, huge, vast amounts. I know Jason in Washington had utilized it with inflammation, oxidative stress, mitochondrial dysfunction. There's tons of research, and Ali has talked about this, and everyone should be aware of this one as well. Stem cells, epigenetics, genomic instability. Your genetics all communicate with an electromagnetic frequency, with a specific frequency. So PEMF is helping all of these processes stay in an optimal range so you can have a health span and not have these age-related disorders set in, all because you began to lose functioning. So you can think about, why am I doing PEMF? Because I don't want to lose my functioning. So, you know, normal aging today, and then the research tells us you spend the rest with an age-related disease. Like I had stated, optimal longevity should be more like this, considering we're spending $600 billion. Another area with prevention and why you really want to take into it is signaling. Electromagnetic fields, PEMF. You do not want damped amplitudes, electromagnetic amplitudes throughout the body. That is where cells begin to lose communication with the rest of the system. And then all of these different disorders, conditions have the potential to set in because there is not an equal balance. And you can think of this where a lot of people have an understanding with osteoporosis. There's not an equal signaling of the osteoclast, osteoblast. You could have a complication. That's sometimes what begins osteoporosis, is a imbalanced signal coupled by time. So how do we improve this? And one way is we are helping with different cellular turnover. And this tells us the lifespan of the cells. And so when you think about, how am I going to see about results? How am I going to take a look at this? Meaning that, okay, your colon cells have a 3 to 5 day lifespan. So you can theoretically generate a
Yeah,
whole new colon cells within 3 to 4 days.
Mute yourself.
Stomach lining, 2 days, bone cells. So that tells you the lifespan. Why it takes such a long time for a bone to regenerate is because the cells are designed for a much longer time than, say, the colon cells or the cells in the stomach. And again, what does PMF treat? You can even look at the veterinarian medicines. In India, they utilize PMF and they treat cows. Now, I don't know how many people in the cow have Lobbler's disease or lumbar stenosis, but this or Lick granulomas, but these are all areas where PMF is treating. And it shows you that PMF does not care if you're a person, plant, or animal. The human organism, the animal, the plant, all respond. So it tells you something about how the whole world is interconnected in a sense that plant, animal, and human all respond to the same pulsed electromagnetic signal. So that is the end. Did we have any questions into this? I think everyone can unmute themselves.
Yeah, okay. Hey, Greg.
Yes.
Before we open up a question and answer, let's introduce a few people.
Okay.
And first of all, everybody please mute your line. And it's disturbing when the talk is going on and I see Helen and Sue, please mute your line. Okay. All right. So let's go to the first guest, Dr. Burton. And he is a holistic chiropractor who has a very good practice in San Clemente. San Clemente is a very nice town located in about an hour from Los Angeles. Mr. Burton, please share with us how you use your PEMF IMR Prime in your practice and with your patients.
All right, thank you, Terry. As Terry was saying, our office, the San Clemente Vitality Center, it's a holistic health center where we incorporate gentle chiropractic, energy medicine, functional medicine to really help all of our clients experience vitality in their lives. The PEMF has really become kind of an integral part of what we're doing, because when we're focused on health, we need the body, the nervous system, and all of its organs to be really functioning at their best for us to experience vitality. And the PEMF is what has really been beneficial for us in that, just as Greg has explained this morning, because of all of its effects on the body, on its tissues, and on the cells. So in our office, we incorporate the PEMF really into our care plans. I would say probably 90% of our clients actually utilize the PEMF. We have a separate unit available so that our clients can actually take it home. They can like rent it out for a week, take it home to actually maximize and increase their use, and recognize that regular use makes a much better impact than sporadic use. Some of the results that we've had in the office, we have one client who generally would have sleep issues. He would regularly wake up around 3 in the morning, and it would not be uncommon for it to take either 2 to 3 hours for him to go back to sleep or not be able to go back to sleep at all. And while we have been working on various things that affect sleep, found that using the PEMF puts him right back to sleep. He bought his own mat, so when he does have these occasions, waking up at 3, he hops on his mat, and generally he finds himself waking up in the morning on the mat. It's just that effective at really helping him find and fall back into his sleep cycle immediately rather than hours later. In terms of a lot of repair, we have. I had one client who suffered a severe trauma to the arm where there was actually a twisting of the nerve, bone fractures, extensive surgery. And so the prognosis from the doctors was very, very guarded and limited in terms of recovery. We had her working regularly on the PEMF from the get-go, as well as just working with her in other ways that we do. But along with that, her recovery surpassed what her doctors expected. So where she was at like a 1 month point after surgery was far beyond what her doctors expected or thought was possible. We also had this with another client who had to have a rotator cuff surgery. So very much the prognosis is you're looking at 6 weeks, at 3 months before this and that. She actually just had a check-in with her orthopedic surgeon, who was just floored at how her range of mobility has come back. She's far beyond where either her orthopedic surgeon or her physical therapist normally sees progression in these surgeries and recoveries. So she's weeks ahead of where her surgeon and physical therapist normally see their patients. And where they would expect her to be. And this is all just because of that effect of the PEMF on the circulation to help with the tissue regeneration, the cellular healing, and then the general pain relief, because that's what many have been able to experience is that when they get on and use the PEMF, they're not only healing better and healing more quickly, but they're actually finding pain relief, they're finding stress relief, they're finding its effects really in many different areas of their lives. So that's really why we have incorporated it into our practice, into the care plans with our clients, and why it's a regular part. I regularly hop on the mat as well. I don't just have it in here for clients. I use it regularly as well because of all the positive benefits that it has. And that's generally what I have to say. I'm open always to any questions, anything like that later on. And for anybody who'd like to come and visit us, we're in South Orange County. Anybody who is interested in giving our office a visit, we always offer a free, what we call Discover Vitality visit. That's just a complimentary visit to come in, get to sit down with myself or my wife, really 2 doctors in the office, and just chat a little bit about your health concerns, and tell you the options we have available here to actually help you reclaim your vitality.
Excellent. Thank you so much. Dr. Burton, you have a great practice. I mean, nice practice there. Okay. All right. Yeah. Very, very happy to have you. Yeah. So the next, well, let's see. We have Marcos and Elizabeth Nunes, Osteostrong owners in Brea, Brea in Brea, which is like 30 minutes southeast of Los Angeles. Very, very nice area. So if you are in the area, please stop by. And they just opened. Marcos, are you there? And Elizabeth?
No, I'm here right now. Marcos is with some of our members, but I can see that in the chat, another member of Osteostrong asked a question, and it's a question that I also had. At Osteostrong, our clients use the PEMF mat once a week. How beneficial is a once-a-week use?
We get that question all the time from the Osteostrong, I would say, and it's very effective. When you think about what you're doing there with a member during the session before the osteogenic loading process, you need to make sure the environment for the bone health is optimal. So the PEMF helps to stimulate the microcirculation to the bone. It optimizes the osteoclast and osteoblast balance and signaling in order to, just like Dr. Burton was talking about, improve the healing times or the regeneration times, or to mitigate or halt osteoporosis. So you are optimizing the body's condition energetically to get the most benefit from the osteogenic loading equipment. So it is focused on that particular session. If you want to continue getting even more benefit from actual bone regeneration and healing faster, you would have to use it more frequently in order to engage the body more than just engaging the body during that one osteogenic loading session. And that's why we always take a look at renting the pads out and setting up different protocols and maybe having different turbo boost periods where people rent a pad for a week or so in order to type of turbo boost the healing times.
Great, thank you. That answers both my question and another Osteostrong owner's question.
Excellent.
But we just opened up a couple weeks ago, and we have a lot of members who come and use the PEMF, and I have about 14 members that come every day specifically just to use the.
Wonderful.
For me personally, I have seen, and I've shared with Terry, an improvement in my digestive system, but our members come every day. So Osteostrong is for the one thing we all have in common, and that's skeletal strength conditioning. And our members see the benefits of the PEMF mat, sees how it slows the loss of bone mass, it facilitates the new bone growth, and has it's beneficial for a variety of bone disorders. But not just that, all the other benefits, I mean, they're like raving fans over it. I have a 96-year-old member. She's sharp as a cookie, but she knows she comes here 5 days a week to get on that mat. She sees the benefits, and she tells me, get that mat ready for me, you know.
No, it's wonderful.
She's, like I said, she's 96, she's sharp as a cookie, but she knows that she comes in once a week for her osteogenic loading, but she's there 5 days a week for her PEMF mat.
And I can see you really changing the health of your community, and I can see you get your passion from that.
Yes. Oh, no, we love it. In fact, we're getting another one probably within the next week. We already ordered it from Terry because there's a demand for it also. One thing that I love to tell my members is that from what Osteostrong provided information about the Omnia mat, the PEMF mat, is that NASA did a 4-year study on the benefits of the PEMF mat, and they found that it improves the growth and repairs the tissues in humans and animals as well.
Mm-hmm. That's right. Yes, that's wonderful. And, you know, and that's the best thing, is that this is evidence-based results. These are not just, you know, well, we think, or it could be possible. These are long-term research over the decades into utilizing pulse electromagnetic fields, changing health outcomes. And bone health is one of them. And the other benefits a lot of times Osteostrong members get is a lot of them have sedentary lifestyle complications. Maybe they are suffering from osteoporosis or diabetes or diabetic neuropathy or Parkinson's. So they're not able to move as much or walk as much or exercise as much. So when they come in, they may already have a diminished circulation, a diminished energy going through the body due to a sedentary lifestyle. So that PEMF mat energizes it up. It gets the energy moving. It gets the cell membranes charged by ion displacement. It gets the blood flowing to the deep levels of the tissue where it may not have the ability to flow before. So these are other benefits, especially for the 80 and 90-year-olds you had spoke about, due to other conditions they may be facing, may have sedentary issues as well. Or the people who go to a job and it is a desk-based job and they come after work, but they were sitting all day. So maybe that body hasn't had a time to, you know, get the circulation going, stretch out the kinks from sitting all day. That's another area of where PEMF prepares the body to take the osteogenic loading process optimally, no matter where you are in your health span or age span.
Absolutely. We're always reminding our members that the PEMF helps them to recover from their osteogenic loading. And
Wonderful.
After they're with after the PEMF therapy session, they're jumpstarting their cells and getting back to health, and it's true. So thank you.
No, thank
Marcos,
you. Thank
Marcos.
you. Like I always tell Terry, I'm an academic. I read things, but when I get to talk to Terry and all her group is when I talk to the individual business owners, healthcare professionals who are actually utilizing it to change people's, using it to increase people's health span. So it's great to actually, hear real stories behind what I'm reading.
Okay, Marcos.
Yes.
Marcos, we're gonna hear you talk. Come on, come to the camera.
What I'm going to say, all the testimonies, I'll be here till next week. Well, we are getting massive results from our clients. I mean, it's incredible. Now that
Tell
we're
me
all
about they're fighting for it, right? Your
fighting.
clients.
Yeah. Well, oh yeah, we had to order another one because we couldn't. It's getting a little nuts. And then, like
Okay.
I said, they're endless. It's really incredible.
Yeah, actually, Marcos had a friend from Utah come and visit in Southern California, and she came on. She's on crutches. She left us a testimony. She did. She couldn't do her osteogenic loading because was on crutches, but she got on the PEMF mat and she walked out of here and ordered one herself.
Oh yeah,
So
Terry, Deanna, I think she bought one from
Deanna,
Marla.
yeah, Deanna, yeah. We
Yeah,
talked to her already.
incredible.
Okay.
Yeah,
Yes.
incredible. That's what. And like I said,
Excellent
this is
result.
yeah. We could get this is endless. We could go down the rabbit hole here for like 3 days on this because we're getting a lot of members, and I'm telling you, they're fighting for it right now.
Okay,
Literally.
very good. Yep. So anybody
Well-
is in the area, Brea area, please stop by the Osteostrong right there, and
Hi.
about 30 minutes away from Los Angeles. Yep. BREA, Brea.
Yeah,
All right. So thank you so much to have you guys. Jason, are you there? Jason? I don't see Jason. He is so busy with his clients. He's not there. Patient to patient. All right. Because last time I didn't get him to talk, but I just want him to share. And he said, let's see. Well, all right. We're going to move on to Marla Lindler. Okay. So you're so beautiful. She is our new member of Pamela's. And she's still waiting for her order right now. I know we're on back order, but she has something her experience to share with us what you have tried in the beginning, the IMR's Prime, the very first time, and tell us your experience and let us hear from you, Marla.
Hi, everyone. Thank you for having me. First of all, when I met Pamela Martin, it was an instant connection. It was it was magnetic meeting her. So I knew we were in the right place at the right time, and she wanted me on this mat through this event that we were at, and she packed everything up and unpacked it just for me and said, get on here. So I finally got on that mat, and the experience I had in one session and it lasted about 2 weeks. It was spiritual. I felt a connection to source. It was the most amazing experience I think I could ever have. And I've been hemming and humming about purchasing this mat for months. I have some minor health conditions, but my son has had 7 knee surgeries. So this is going to benefit us immensely and promoting it as well. Beside that, I felt this overwhelming sense of connected to source. It's called a Christ consciousness. And I'm not religious. I am Jewish. I'm not Christian, but I felt this, and I can't deny this. And it lasted 2 weeks, and I'm yearning to have that connection again, because when I had that connection, I also feel that it's connected to the pineal gland, also pineal gland. You could pronounce it either way. Between that and the piezoelectric effect, when you are on the mat and you have this technique of breathing when you're bearing down, what I've learned with the piezoelectric effect that sends the spinal fluid all the way up to the brain, and it triggers the pineal gland. And then you have the crystals in that pineal gland that acts like a radio signal antenna. And that is probably where I had that Christ consciousness connection with the universe. I have candida, and so I have been searching with supplements, and I go to a chiropractor where we did the light therapies, vibrational therapies, the megahertz therapies. So I was a little, familiar with this, but I have spent thousands in supplements and healthcare, and this PEMF mat, I know it will benefit my son and myself, and I could promote it to others. Thank you for having me.
No problem, and you're absolutely right about the spiritual aspects of it. There are retreats where people are guided and they lay on the PEMF mat. Years ago, they did it in the field at Hippocrates in West Palm Beach. And basically the whole body mat, when it utilizes the magnetic resonance stimulation, it is stimulating the ions that are traveling in the spinal column. So you're basically amplifying the signals in the spinal column. So when you do the deep breathing techniques, the PEMF is amplifying all that and sending it through the meridian system, the fascia. And as you know, the electromagnetics can turn into protons. So that process is all being heightened in a sense when you put yourself into that state, when you meditate, pray, deep breathe on your whole body mat. And you can even use the pillow pad up on the spinal column if you're traveling, or you just want to take it outside and lay in the grass or whatever.
I also feel, with the pineal gland and decalcifying it to get full optimal effects, I think that promoting decalcification of the pineal gland would be a really important thing for people to learn and educate themselves on how to do this.
I think that's excellent. And the other benefit of PEMF is it boosts the body's ability to detoxify, for the cells to detoxify, because you have to remember, just like osteoporosis and your bone health, PEMF helps the trucks that go in, and the truck, I always say, think of it when you remodel a house. You have to have the trucks take all the old stuff out, and then the trucks bring all the new stuff in. And that is how the body regenerates. So you need that process going. So the PEMF stimulates the signals, the energies, the cells that's going in, and then it takes out and optimizes the elimination of all the toxins as well.
Very good.
I
Wow.
see have one other question in regard to dizziness. And this is a common issue with individuals who may be on a whole body mat, and it is one of the areas concerned that is also in the operator's guide. And it's just all about the displacement of blood, and that is what's causing the lightheadedness and dizziness. And people who are in a weakened condition or going through a disease or illness generally experience this due to the imbalances within the body. But Marv, you can actually look in I think the safety section in the manual, and it actually talks about one of the concerns is if an individual gets up and they are dizzy, just make sure they take a couple deep breaths. With chemotherapy, you always want to get your doctor involved, and I always tell anybody, PEMF is generally best for afterwards. But again, this is just really something you want to talk to your doctor about. But, from the gut, you don't want to increase or take out anything from the body faster when you're going through chemo, because your doctor probably has everything very well balanced. So unless your doctor is okay with it and advises it, I would not do anything to, alter any of the therapies your doctor's doing without his 100% approval and him knowing what's going on and what to watch for. Because remember, PMF could speed up metabolism. Do you want the chemo going in faster? Do you want the chemo going out faster? So you really need a doctor to be involved in that process 100%.
Yeah, very good. Who would have questions or like to share? So speak up, please. Yeah.
Okay, I'm going to speak. Hey, this is Mark.
Hey, Mark.
Hey, good morning, everybody. I just wanted to share this real quick because I thought it was pretty phenomenal. So my friend, she has the IMRS Prime hybrid. She had bought the Omnium, and 6 months later, she bought the IMRS Prime. She has a daughter about 10 years old, and she and her little friend both broke their arms at the same time. So of course I told her, of course, use the mat, but I told her to use the, the hexagon spot at least 4 or 5 times a day, whatever length of time it is. So she did, and she, just so you know, the mom is a nurse and everything, and she obviously loves the mat and blah, blah, blah. So she said that on the 20th day, the doctors told her to take the cast off and she freaked out. She's like, no, it's way too soon. It's way too soon. Because obviously, as we all know, 6 weeks to wear the cast at least. And she said, no, she showed her the x-ray. She says, it's done. You're good. We have to take it off. So in 20 days, her cast was off. And then, of course, her little classmate, she had to wear it for the full 6 weeks. So I thought that was pretty powerful. And it was fun to watch for my own personal friend to feel this way and stuff. So just had to share it.
Thank you.
Osteostrong.
Yeah, thank you so much, Mark, for sharing. Who has the next question?
Hello,
You have to unmute yourself.
how do I do that?
Yeah, we can hear you now. Yeti? Right.
Okay, people with metal in their body, we're not supposed to have any metal when we're on the mat. So how about if people have metal in their body?
Metal in the body? Generally, if you have metal in the body, that should not be an issue unless it is a contraindication, which are the electrical implants, which is a insulin pump, a pacemaker, or anything that is implanted, even a hearing aid that's implanted. You would have a contraindication with the PEMF. But generally, metal is not an issue. With it, and there are a lot of people who have titanium plates or some type of hip replacement or knee replacement, and they don't have any type of issue with the PMF.
Before we let somebody use the mat, we ask them, do you have metal in your body? I don't want to be responsible of, any issues there.
What was that?
So if somebody have knee replacement or hip replacement or in the heart, stem in the heart.
If you had a knee replacement or a hip replacement, there's a lot of research where they use PMF post-operative. They use it in plastic surgery a lot, especially if people do not want opioids. They use it as an alternative, or maybe they want a weaker opioid, but they still need something else. But a lot of people utilize it afterwards in order to help the healing process from the surgery, help reduce the scar tissue. And like we had talked before, all healing needs a high electric current within the area in order for the body to optimally heal. That's why a lot of times diabetics have wounds that won't heal because there's no blood, there's no energy, and the tissue begins to die. There's no oxygen. And that's what the PMF helps. The PMF helps drive the oxygen, the blood, the circulation back to the tissue, and helps reduce the symptom of neuropathy. But yes, a lot of people afterwards, I think even Pamela had one of her friends utilize it after a double hip replacement, and they had great healing aspects from it and healing timelines.
Be sure that they
Very good. So who have the next question? Oh, Adriana, Pamela, you guys can share too. Unmute yourself.
Hi, good morning, everyone. Thank you, Terry, for this wonderful meetings every month. It's a lot of information every time comes to more and more information. So thank you for putting it together, number one. Number two, regarding about the osteoporosis, I understand there are different protocols and using the mat, as they say, once a week or do it regularly, daily. If somebody can direct me how to use it in like daily, at what measure or how many minutes and something like that to create like a protocol, that would be great. I understand also Elise talk about the pad as well. So less is more, but yet with the pad, you can use it more. So if you can touch on that briefly, that would be great. To create some protocol for that.
Yes. When you use it weekly, its intended use is to benefit a osteogenic loading session at Osteostrong or any facility that you are optimizing the osteogenic loading process by driving the blood and the energy to the bone. So whether one of the members has any type of health challenges or conditions which could inhibit the benefits of the osteogenic loading process, you are mitigating that by utilizing the PEMF. So the PEMF is focused on that one specific weekly session at the, for example, Osteostrong centers. Now, if someone is seriously looking to work with PEMF and osteoporosis, all the literature says is you would need to utilize a pillow pad type applicator multiple times a day for about 4 hours. So you would really need to think about, you know, in the morning, where am I going to work this in? Can I take it to work? And that's why you had pointed out the pillow pad is great because you are able to use it for longer durations. Because of the study by NASA into the square waveform, because the square wave has less stimulation than a triple sawtooth, you can use it longer because there's less stimulation points than a triple sawtooth. And you're stimulating a local area. So you would really, you know, need to, when you're on the computer, you should be, you know, utilizing the pad. When they're sitting on the sofa watching the TV, they should be utilizing the pad. When you're laying in bed, when you're maybe at work and you're sitting down. So that's how you would get the pad. Most of the time it would be the Omni pad because it's the, you know, most effective for traveling like that. So you would use the Omni pad, and that is where you can take it and really get that. A lot of times people will look at the 9-month timeline because that is when you can get a DEXA scan or you can then see results. A lot of times people, and a lot of the Osteostrong members are the ones reporting they're healing faster than the 9 months. So, you know, somebody would, and again, you could see cellular turnover in the bone. It takes 9 months to regenerate a bone. It's like if someone told you it's going to take 9 months to regenerate your to renovate your house. So you have to be prepared for 9 months during that renovation. And that's the same with your bones. You know, did that answer your question?
Oh, excellent, definitely. I say for years, I've been having this, the Omnia one, and I've seen magnificent results on myself and also on people that I see. And to see more people coming and getting this information on not just one thing as an overhaul, and you explained it up to point, that to me is magnificent, because now as a community helping the people can modulate this and have more strong conviction to tell them, yes, this is how you're going to do it. These have been the results on the other companies that we hear, Dr. Burton and the other company that is in here. So, and more, and it's like fantastic. So you're not going alone, thinking yes and read this, but no, you hear the echo. So that creates, as you know, with the Omnio One, this energetic field that comes back to you in a bigger form, not just limited beliefs, but yes, in a holistic way. So thank you so much, Greg, for your wonderful bringings every time, new information. That's incredible. And Terry for bringing that to us. So
no,
thank you,
and
Adriana.
thank you for touching on the point that, you know, helping the communities we serve is an utmost important now, because we are seeing that the virus hits those with poor health, in bad health conditions, with chronic diseases more than those who aren't in poor health. And this is a wake-up call for everyone that we need to start moving, we need to start walking more, and we need to start being preventative in our health, because anything you read about pandemics, they don't go away. They last for years. If you look at the Spanish flu pandemic in 1900s, there were different variants. So we really all need to be inspiring the people who are in our communities and who we serve. This is the time to really get serious about your health and get walking and get moving and get stretching. And if you have any type of health complications or concerns, it's time to take a serious look at them and see what type of changes you can make, because your health is everything, you know.
Can I recommend researching high vibrational foods? We absorb the energies of these animals in their life and how they live in fear. So we're absorbing their energy into us. So
I think that could be why this whole world is so anxious. If we look at the way we slaughter animals, even plants.
And plastics are in everything. They line cans, and that has hormones in it.
I mean, there's a whole plastic island in the middle of the ocean. It's
probably
where we're all going to be living soon.
Yeah, right.
Okay, great. Any one or two questions quickly, and anybody they can answer.
Hi, Terry.
I just got a text that Jason apologized that has emergency. We're gonna get him next time. Go ahead, Dr. Bill.
Sure. How about a teenager, very active in athletics, playing basketball, at the end of the season got COVID, and that was diagnosed. Got through that fine, but since then her energy level's just been terrible, and she has chronic headaches now, migraines, and the parents, I was just talking to the parents the other day about this, and more for another member of the family, but they could see where this potentially could help her. What would you suggest on that?
Well, there's not too much research, obviously, because we're all just in the midst of this, and you know, it's not you know, people are focused right now on just getting the situation dealt with and under control versus looking at different alternative and complementary medicines. But I would always think about just the core benefits, in a sense that blood circulation improvement, all of these types of areas, boost immunity, pain relief, energetic levels. This could, I would say, again, this will help improve the healthy aspects of her, but there's no research into showing whether or not this will have any type of effect, you know, with coronavirus or symptoms like that. PEMF is going to do what PEMF does, regardless really of the PEMF doesn't know if you have corona or diabetes. It's going to do the same benefit no matter what. So if improving blood circulation, if improving bone health, which is all going to put the body back into a good state, could be good. A lot of times too, what we're finding is that everything is entering through our respiratory system. And they're finding athletes from the Olympics to Major League Baseball are all getting it. And when you think about what is an athlete doing, deep breathing in and out of the nose. And that is where you are at most risk for transmission. So that could, any type of benefits where you can boost the body to be able to deal with those challenging situations, I would say would be good.
Thank you.
Mm-hmm.
All right, who has the last question?
Terry, I have a quick question.
Joy, go ahead. Yeah.
Hi, I just wanted to ask Greg really quick about the sense, because I have someone who got the sense and is being monitored because she was just in the hospital for pneumonia, but the sense's numbers are so different than the readings of a pulse ox and what she knows the oxygen and her pulse to be. We rebooted it and it was better, but it was still wonky, and she's stopped using it right now because she's afraid that she doesn't want to have the treatments based on readings that don't seem to be correct for her at the moment. And I just wanted to ask his advice on how to proceed with that.
Well, what I've discovered is that you are comparing readings that she's receiving PEMF treatment, which is altering her body. So, and then you're getting the readings. When she's getting her readings from the medical community, she is not receiving PEMF at the same time. So you really can't, you're comparing apples to oranges. It would be just like when you go to the doctor, when you take your blood pressure, you have to put your arm in a certain position to get accurate readings to be able to compare, because they will then compare your different readings, but you have to have your arm in a certain place. You can't compare a blood pressure reading when your arm is up in the air to where you're laying down. And when you are using the sense's intended purpose is to provide a more dynamic pulsed electromagnetic field experience, utilizing heart rate variability as the indicator of whether or not to adjust the magnetic field parameters. It's not used to diagnose anything. So simultaneous, while she's getting these readings, she's also getting PEMF therapy, possibly utilizing light and sound therapy. So her readings may be a little altered or maybe a little off, because she's comparing her readings to when she's not getting the PEMF, which is a completely different environment.
But the readings from the sense are so much less. Like,
well, you're trying to diagnose from the sense, but that is not the intended use. The intended use is to get the reading and then adjust the parameters of a magnetic field. And when you look at the totality of the readings from the recorded history, you can then see the averages. But there will be in heart rate variability, it's called artifacts, where you will have readings that some are high, some are low. And then when they do the cubios, they scrub it and they take out the anomalies, the artifacts, and that's how they get the reading.
I see.
We're actually seeing the raw data being transmitted with the anomalies in the artifacts in it, because that's not the intended use to diagnose anything. It's more like an educational reference where you will be able to see the pulse ox, and then that is, or the heart rate variability, and then those are used as indicators to move the magnetic field parameters as they adjust.
I see. One thing, I just was wondering if we should have it checked, because when she put pressure on it, on her finger, the readings changed. She shouldn't have to do that, right?
Well, I mean, I'm not, again, we are, almost talking apples to oranges. You're trying, the PMF.
I'm still trying, I get it.
The sense is not going to diagnose her readings.
Right.
It is just going up and down. If you want to try it on another user. What readings do they get? Put somebody else on the sense. And that's what I always, and see what it is. If somebody's going through medical challenges, they may have poor circulation. So they may have different, if they're moving around, if you are 100% focused on the reading, you are not getting any PMF, you're agitated, your stress levels go up, you're increasing your blood pressure. You are bringing your, when you get on, I tell people, if that reading drives you crazy, put a towel on it because it's ruining your health and it's ruining your PMF experience. You should not even look at that until after the session is complete. And because the first thing you want to do is, if you're hydrated, you want to make sure you drink water. Then you want to lay down and you want to deep breathe because you want to be able to relax and calm as much as possible in order to get the most beneficial aspect from the PMF. But if you are agitated, increasing your sympathetic nervous system because you're all angry at the number on the screen, then you have to just stop looking at it because it is not doing anything to improve her health. And in fact, it's actually deterring her from improving her health by not utilizing the device because of a number that is not going to be the same number, because it's like when I drive my car on the highway, it says 80 miles an hour, but when I drive my car on the country road, it says 25 miles an hour. And it's because you're on a different road. And that's the same with the reading. That system is giving you a reading based on a body that is being stimulated by a magnetic field. And when she is getting a reading with a medical professional, they have her in a standard position, still and calm, and they get their readings. So you can't really compare them unless you look at the averages from the records management system, and you can print out all the raw data, and there's sometimes 30 pages of data, and you can print it out, put it into an Excel, and you can see the averages then. And that is what I always tell people to compare, is the averages, and you do it over time. And that is where you'll see more accurate numbers. But you could lay on that device and all of a sudden you could see 180 heart rate. But we are not in a medically acceptable body position or environment to be taking diagnostic measurements from the body. You're not even supposed to be talking. A lot of times when people go and lay on the mat, they're talking, they're laying down. Why isn't this doing this? You're not even supposed to be doing any of that type of movement when you are taking accurate medical diagnostic type of measurements.
Thank you so much. I can explain that better now.
Yeah, and that's it. And it's really preventing her from getting the, the benefits of it. But I always tell everybody, because she's not alone, that's like 80% of the people who use the Sense have that same question and concern. So she's not alone. And that's why I always tell people, sometimes it's best to start it, lay down, and then look at it afterwards.
Right, it's true. Because one of the numbers once was 0, and that was just.
Mm-hmm. Yeah, so I mean.
And a bunch of the other ones were so, but now I can explain it about the whole difference in the focus.
Setting,
so,
it's really the setting. And think about the medical professionals. They have you lay in a standard position. It's quiet, no talking, and then they take their measurements. And generally, most of the time I see anybody with a sense, you're sitting down, you may be having a conversation with another person in the room, your arms are moving, you're trying to get yourself comfortable on the mat. You have a pillow, you know, and then why does it say 0, you know? So it's a different environment, but it does not, because some people always think of this, some people use the PEMF and get benefits and they don't even have a sense. So the sense has no direct effect on the benefits of the PEMF in a sense, meaning that there's nothing the sense can do to ruin her PEMF session.
Right.
Yeah,
Good.
so
That's
yeah,
also
so it
good to
doesn't
know.
matter what the numbers say, because there's nothing that can ruin her PEMF session. The sense can just provide a more dynamic experience, but it cannot diminish the experience.
Great, Greg. Thank you so much.
Thank you. It's so thorough explanation. Great.
But
So-
like I said, it's a question, it's a common question from many, many people. And so, you know, I got better, you know, as the question keeps getting asked, I keep getting better at the answer.
It's wow, thank you so much. It's an hour and 15 minutes already. So thank you. Thank you, everybody. Oh, Jason, Jason, you're finally here, but we'll wait to hear from you next time, okay? All right. So thank you, everybody. Thank you, Greg, Dr. Burton,
Thank you,
and
Greg.
Marcos and
Thank you
Elizabeth
all for
and
attending.
Marla.
Thank you so
Thank
much.
you, everybody, on the
Thank you.
webinar. We'll see you next time, September the 18th. Okay.
Hey.